Who's next? In the new episode of COVID Chronicles, we will tell you which categories of citizens have started getting the coronavirus vaccine in Kazakhstan. The vaccine will become available in phases. How the doctors from the capital who are in love, a general practitioner and an intensive care physician, had to cancel their wedding because of the pandemic. We both have been working in a dirty zone with patients with COVID. Let's hear firsthand about the epidemic situation in the eastern United States. I think people have had enough of being under endless stress. We are going to tell you why eating fruits and vegetables is so important for rehabilitating after COVID. Common onions, garlic, and cabbage contain a fairly significant amount of vitamin C. They have started vaccinating teachers and policemen in Kazakhstan. These are categories of citizens who get the coronavirus vaccine first in the country. For example, in the capital, there are more than 50,000 people on the vaccine list. Vaccination points are organized in 36 primary healthcare organizations in the city. According to data of the Interdepartmental Commission on Preventing the Spread of COVID-19, more than 28,000 people in Kazakhstan have been vaccinated during the first phase. Half of them have already received the second dose. The vaccine will become available in phases. In the first phase, medical workers, teachers and employees of special government agencies get vaccine. In April, we will have more vaccines. We will receive additional 150,000 doses. I think it will be available voluntarily to all segments and categories of the population. In the first moments when this infection was announced, our administration made sure that we were prepared for it. We knew the list of issues, we knew about compliance with the treatment regimen.
Изначально я была в приемном покое. То есть это горячая точка, которая поступает по линии скорой.
Initially, I was in the admission ward. It is the hotspot where they admit people brought by ambulances and people who come on direct individual appointment. The flow of patients was large, especially when the first wave started in summer. The workload was crazy. The people weren't ready. The doctors didn't have time. There was a shortage of stuff. There was a workload. We also lacked supplies. But at the same time, the emotional support of our relatives helped us to work hard.
Вообще профессия врача, она как бы подразумевает того, что...
The profession of a doctor implies that you come here voluntarily to work for the benefit of your patients. You should be emotionally prepared from the very beginning. The only thing is that the conditions have changed. Hazmat suits, certain PPE. It was hard. However, it was a team effort.
Да, было тяжело, но тем не менее, как бы командная работа. Из-за дефицитности кадров у нас
We
были
worked overtime during our duties because of the staff shortage. We worked 24 hours. After 24-hour duty, you could continue to work at night, day. There was an overload. This was because there was a shortage of doctors and the flow of people was large. At that time, we accepted people from the whole city because certain COVID centers, temporary hospitals, were opened. Initially, we had an infectious disease department. There was a large flow of patients, but after our hospital was turned into a clean zone and we accepted people from the whole city.
После мы стали чистой зоной и обслужили весь город.
I remember the first patient with COVID. It was a foreigner with a suspected coronavirus infection. He came in with clinical symptoms. There was an epidemic anamnesis. After he arrived, we were closed in the filter room for 2 days.
Раньше было так, то есть эпидемиологи работали тоже в штатном режиме.
The epidemiologists used to work on a routine basis, and they were the ones who took action. If we had a patient with a suspected coronavirus infection, they were isolated so that others did not come in contact with them. The one who first came in contact with the patient, the one who accepted him, her, took the tests, including nurses, middle, junior medical staff, got isolated. We discovered that the patient had suspected coronavirus infection, took a PCR test, sent the result, and waited. At that time, virology labs were over busy. We waited for the result, and only when it was ready, we were released. We have a filter room. There is a separate sanitary room, a separate place where the patients stay, and at that time we stayed in that room. You just didn't have time.
Ты просто не успевал. Вот тебе поступает и пневмония, и параллельно...
People with pneumonia came in, patients with other illnesses, anaphylactic shock, allergies, chronic illnesses also came in. I remember that the ambulance used to bring 3, 5 at a time. They just waited to be accepted. We first accept the most urgent patients with severe respiratory failure. There were urgent calls. They were bringing severe patients and wanted us to prepare resuscitation. In the admission room, a doctor, resuscitationists, and other specialists waited. It was a difficult process. The flow of patients was 2-3 times larger.
Тяжелый вообще процесс, поток, это 2-3 раза намного больше.
We both have been working in the dirty zone with patients with COVID. He's an anesthesiologist and resuscitationist. We didn't see each other for a long time. We contacted only by phone. He worked in the resuscitation department, the infected zone, and I managed patients from the admission ward and inpatients. We're both doctors, and we understand the seriousness of the situation. One of the most difficult coronavirus situations is still in the United States. The country is the world leader in the number of people infected and dead during the pandemic. Alessia Wasserstein from the United States is joining us. Alessia, hello. Please tell us about the coronavirus situation in the United States.
Здравствуй, Саби. Я на данный момент проживаю в городе Филадельфия.
Hello, Sabi. I'm currently living in Philadelphia, and I would like to say that the situation with the coronavirus reminds me of the well-known Russian fairy tale. We go there, we don't know where. We do this, we don't know what. I can see that my fellow citizens are divided into two groups. The first group believes in vaccination and that it is the elixir of eternal youth, eternal life. The other group, on the contrary, does not welcome or understand vaccinations and does not believe in their effectiveness. This is a very sensitive and serious issue at the moment in the United States. The situation varies from one state to another, and as far as I know, there are specific phases of vaccination and categories of people who get the vaccine first. By today in the US, they have vaccinated healthcare workers, elderly people, and people whose immune systems may be susceptible to various diseases. Generally speaking, people have calmed down a bit and are trying to maintain the same standard of living that we had before the pandemic. Some of the people are afraid of the situation very much and are trying to stay away from everyone, to stay at home, and they only go out when necessary.
Очень-очень боятся происходящей ситуации и стараются находиться вдалеке от всех, стараются сидеть дома и выходить лишь по крайней необходимости. У нас открыты рестораны, у нас открыты определенные общественные места, не все, насколько мне известно.
We have restaurants open, we have certain public places open, not all of them. Restaurants, stores, movies are about 50% open. As far as I know about studies of school children and students at the universities, it depends directly on the management. That is, some institutions work online, some institutions are still open.
Некоторые учреждения все-таки открыты. Я думаю, достаточно поднадоело людям находиться в бесконечном напряжении, в бесконечном ожидании разрешения ситуации к лучшему.
I think people have had enough of being under endless stress, waiting for the situation to be resolved.
Вернуться к жизни, которая у нас была до пандемии.
I think most people are trying to get back to the life we had before the pandemic. A lot of people are tired of being at home. I see many people outside in the city center and various public places. As far as I know, much more people are visiting national parks, local parks. People are trying to be out in the fresh air. People are trying to do something to distract them from bad news and forecasts.
Не совсем хороших новостей и прогнозов.
Alessia, thank you very much for the interview. Take care of yourself and your family.
По данным мировых экспертов, уже ясно, что, конечно,
According to world experts, it is already clear that the state of the immune system before the disease, during the disease, and after the disease is impacted by the overall infection process. Of course, the issue of rehabilitation of the immune system is quite complex, because many mechanisms are important for the immune system.
потому что для иммунной системы важны очень многие механизмы. Пациент у нас, соответственно, разный, да, то есть с легкого до крайне тяжелого.
We have patients with mild and extremely severe symptoms. Some patients had an already altered immune system before the disease. If a patient somehow experienced the infection with severe or not severe symptoms, what is needed for the immune system to recover and work normally? Homeostasis is needed. Homeostasis is a line that shows that everything in the body is fine. The normal content of sugar, normal content of saturated lipids, normal content of microelements, vitamins, any substances that are needed for the synthesis of cells, proteins of the immune system, so it does not experience any deficiency.
Чтобы она не испытывала какой-то недостаток. Но состояния бывают разные. Пациент может в каких-то определенных случаях, то есть испытывать...
There are different states. In certain cases, the patient may lack certain foodstuff as a result of an underlying disease. So it is important to understand what the patient lacks, what can be added so that homeostasis can be normalized and the microelement and vitamin composition can be normalized. For example, all people in Kazakhstan lack iodine because we are far from the seas and oceans. Besides, we suffer from vitamin D deficiency because we spend too little time under the sun. It has to be compensated somehow. We don't mean some external exposure, foreign foodstuff.
Что-то должно быть компенсировано. Но если даже мы не говорим о каком-то внешнем воздействии, внешних продуктов питания, мы с вами говорим...
We mean a normal variety of food. We can eat beshparmak and baursak, but we should also add raw food. We have enough choice. We can buy raw cabbage, carrots, greens, parsley, and dill. It's clear that in spring, all the vitamins we collected during autumn and summer can get depleted, especially vitamin C. I suppose almost everybody knows what a raw food diet is rich in vitamin C. Raw fruits and vegetables have vitamin C. People think that mainly oranges and tangerines are rich in vitamin C. No. Common greens, parsley, dill have the highest vitamin C content. Then goes fresh currant. Common onions, garlic, and cabbage contain a fairly significant amount of vitamin C. A diverse diet is very important.
Нормальное разнообразное питание, конечно, оно важно.